Africa is one of the world's most unhealthy continents. It falls behind the rest of the world. The gap has widened since the 1980s due to the human immunodeficiency virus and acquired immune deficiency syndrome, also known as HIV and AIDS. These have hit Africa harder than any other region on Earth. Many of these health conditions can be blamed on factors other than ineffective responses to these illnesses, such as government involvement, poverty, and the geography of Africa. African governments started to move their countries towards facilitating health insurance. With this, many schemes were formed and large amounts of health budgets went missing. Arranged problems made it hard to provide services to many people. Poverty slowed down the private healthcare initiatives. Conflict affected their health through the high number of deaths and injuries. Africa is where the vilest germs and parasites flourish, and no one knows how to cure the diseases people receive from these bacteria. According to the richest article, developing countries face great difficulties as they attempt to improve their healthcare systems. If improvements were made, more than 8 million children's deaths would be saved per year. Children who aren't part of the 11% who die before they turn 5 years old are likely to suffer from malnutrition, parasitic infections, or other recurring illnesses. Some of the worst countries in the world for healthcare are in Africa. A few are Zambia, Liberia, and Sierra Leone. Zambia is located in southern Africa with a population of about 14 million people. The life expectancy here is 55 years, and the leading cause of death for children under 5 is a diarrhea disease because they do not have access to clean drinking water and appropriate sanitation. Almost half of the population of Zambia is under 14 years old because of the high birth and death rates. Liberia is a country located in northwest Africa with a population of about 4 million people, and the average life expectancy is 57 years old. Liberia is the only country in Africa colonized by the United States, and their largest medical center in the country is named after John F. Kennedy. 43% of the population is 15 years old or younger. Malaria is their biggest health problem, with over half their population to be reported to have it in 2010. 43% of children under 5 do not receive any anti-malarial treatment. Sierra Leone is the #1 country for worst healthcare in the world. This country is bordered by Guinea and Liberia and has a population of almost 6 million people. Sierra Leone is slowly recovering from their civil war that ended in 2002. Very few people have access to health care coverage. Pregnant women in Sierra Leone have the legal right to free health care, but the country does not provide midwives or hospitals. There are about 2 doctors and 400 medical beds for every 1,000 people. More than half of the country does not have access to clean drinking water. The life expectancy in Sierra Leone is 54 years old. There are low HIV and AIDS rates here, but malaria makes up for those. Citizens are hopeful that their governments will increase their access to health care. In 2008, there was a study done to see what the causes of death were in Africa and compare those to the causes in the world. According to KPMG, transmissible diseases, maternal and prenatal conditions, and nutritional deficiencies instigated 27% of the rest of the world, as opposed to 65% of deaths in Africa. Infectious and parasitic diseases caused another 63% of deaths in Africa, as opposed to 15% in the rest of the world. According to KPMG, on average, Africans live 14 years less than the average world citizen. There are only 2.3 doctors for every 1,000 of people in Africa. Compared to the rest of the world, there are on average 14 doctors for every 1,000 people. There are more than double the numbers of children deaths for every 1,000 people. There are triple the number of maternal deaths per 100,000 births. On the other hand, the maternal mortality in Africa has decreased by 27% over the past 20 years, and mortality of children under 5 is decreasing by 2.5% per year. Yet, Africa will remain behind the rest of the world in health for many years.